you've been offered an interview for your dental hygiene or therapy application. The university's gotten back to you and they're going to interview you, and you're now panicking like, oh my god, how do I prepare for this? Don't worry, I've got you. I'm Dr. Rads and I've been helping people to get into dental hygiene and therapy for the last 6 or 7 years. I'm going to tell you exactly what the different interview styles are, typical questions that you'll get, and how to prepare for the most common questions. I'm also going to give you tips and tricks and keywords that you need to mention in an interview. One thing to note is that different universities use different styles of interviews. So they have 2 main traditional types of interviews. One is called an MMI, which are multiple mini interview stations, and then we've got panel interviews. So the traditional panel interviews where you've got interviewers on one side and you on the other, and usually there's 2 or 3 interviewers. The interviewers can consist of admissions tutors, clinical lecturers, or even a dental hygiene or therapy student. For the multiple mini interviews, it's a series of mini interviews, so different stations. Usually at each station is one interviewer and there's a task, a role play, or maybe a question. Now, both of these can be daunting in their own ways. I personally prefer the MMI style because I like the idea of, after I had the first station, I was a bit nervous for the first one and then I felt like I settled in. Then you can move on to the next station and that interviewer has no idea how well you performed or how badly you performed at the previous station. Every single station is an opportunity to prove yourself in a different way. And I also liked that MMIs were quite practical and some of them were role plays, and I feel like it really tested me. Whereas traditional panel interviews can be a little bit easier for certain people. So just different interview styles adopted by different universities. But the most common questions that you get across MMIs and also the panel interview are the general questions. Why have you chosen dental hygiene or therapy? Why have you chosen this university? Tell me a bit about yourself. What have you done to prepare for university? What experiences have you had that have built your communication skills, leadership skills, teamwork skills? So you're going to have the general interview questions, which are like introductory questions, which are like, tell me about yourself, maybe introduce yourself. Then they'll move on to skills-based questions. Skills-based questions are assessing the skills that you need to become a dental hygienist or therapist. So generally it's things like being able to problem solve, being adaptable, maybe resolving some conflict. So you've got the introductory questions, you've got skills-based questions, then you've also got values-based questions, which are a test of understanding what your values are. And these questions can come in a variety of different forms. So one example is, how would you manage conflict between 2 team members? This is an example of a question where they're really testing your values and trying to understand what your role is within a team and trying to understand, are you somebody who's going to resolve the conflict? How are you going to do that? Are you going to leave them to it? Are you able to communicate and mediate between the 2 groups? That can really test your ability to think on the spot and also to share your values as well. Now, when I'm saying values, what I'm really referring to are the NHS values. These are key values that you need to know about for your interview. These are things like compassion, respecting dignity, commitment to improving lives, commitment to quality care, working together for patients. These are all key values and you can implement them in your answer. It also incorporates things like being non-judgmental, showing empathy towards others, being inclusive, respecting diversity. These are all key words that you need to know about. Some universities love asking about these kinds of questions. Knowing your NHS values or even implementing them in your answer is a really good way to stand out. Here are some more standards and values that you need to know about. These are the General Dental Council standards. So if you're a dental nurse, for example, you probably already know about this. If you're a student, it's good to know the GDC standards. These are 9 standards or principles set out by the General Dental Council, and it's put into place to keep us safe as professionals and also to help patients and keep them safe as well. So that could be things like working together for patients, commitment to care, and that can be things like working in patients' best interests, working together as a team, having effective communication, gaining valid consent. These are all key things, and there might be an opportunity to use these keywords throughout your example. Let me give you an example. Say they ask you, how did you find your work experience? And that's when you can really go into detail and say, this is what I saw, this is what I learned, these are the skills and qualities I recognize a hygienist or therapist needs. I have built these skills through doing these 3 things. And that's when you can say, in the skills and qualities part, I noticed that the hygienist or therapist was respecting the GDC standards, was showing compassion to every patient, and they were also working together. Key things to know: GDC standards, know your NHS values, plan out your answers. So for example, if it's a tell me about a time question, these are skills-based questions. Tell me about a time that you had to problem solve alongside a team. That's where you'd pluck an example from maybe school, employment experience, work experience, time where you were faced with a challenge, you had to problem solve alongside a team. For these skills-based questions or tell me about yourself questions, you need to answer it in a very structured way. And we use the STAR method for this. The STAR method is broken down into STARR: situation, task, action, result, and a reflection. This is just a really structured way to break down your answer. So I'm going to give you an example. Tell me about a time that you had to problem solve alongside a team. This is an opportunity for you to use the STAR method. So really, it's not about what you're saying, but maybe the actions you're taking, saying in a clear, concise way. They're really judging your communication. Dental hygiene and therapy is a course which is really focused on patient care. The whole career involves you talking to patients every single day. That could involve talking to 15 to 20 patients every single day. It is an intense career and they want you to be able to problem solve. They need you to be able to work as part of a team. They want to see that you're going to fit in with the rest of the group as well, and that you're easy to talk to, you're conversational. When it comes to all those skills-based questions, you want to really focus on preparing examples for things like leadership, problem solving, communication, teamwork, how you resolved conflict. Conflict really crosses over into another set of questions, which are situational judgment questions or ethical-based scenarios. These questions test your ability and how you would behave in situations that are a bit unnatural. For example, one situation could be, how would you handle a fellow colleague cheating during an exam? How would you handle a colleague coming up to work drunk? How would you handle a fellow student stealing notes? Things like that are really common scenarios, and they're really tackling your ability to understand that this is immoral, this is wrong. You're understanding the theme, what's going on here. Is it a breach of confidentiality? Is it a situation where maybe you need to whistleblow because somebody has done something wrong? Are patients being harmed? It's recognizing all of these things together, recognizing the theme, and being able to also implement those key words. I would show compassion. I understand somebody has made a mistake, but it's also our duty to be accountable for our mistakes and learn. We're students, but we still need to be better for our patients. So kind of just dropping in keywords there, I think, can make you really stand out. And I think that's where dental nurses have an advantage over A-level students, because they have got that experience of implementing the GDC standards into everything they do and really dealing with these scenarios, real life scenarios, when they're in the workplace. I've just given you an introduction to the various different topics that you can have in interviews, the different interview styles. So let's recap. So we have panel interviews and we've got MMI interviews. We've got different interview questions, and different universities adopt different styles of questions. So for example, general questions, tell me about yourself, why this university, why hygiene and therapy. Then you've got skills-based questions, maybe NHS values-based questions, like what does empathy mean to you? What does compassion mean to you? What are the NHS values? And then we've also got the other questions like situational judgment or ethical scenarios. There's one last group of questions or stations that you get during MMI interviews, and these are role play or manual dexterity scenarios. These stations are more of a challenge of your manual dexterity, for example, your hand skills. Dental hygiene and therapy is a very practical career. Now, while I don't think you can prepare for these manual dexterity stations, it's good to be aware of what they are so you're not shocked on the day. The second lot of stations that are quite common in multiple mini interviews are role play scenarios. Role play scenarios, they can be quite challenging. They're quite difficult. If you've never been in a working environment or never worked with patients, I think it can be quite a challenge. Don't hesitate to invest some money or extra time to making sure that you're getting the practice that you need. There are so many online resources. I've got a dental hygiene and therapy interview guide which has so many past university questions, model answers, skills-based questions, values-based questions. It's a really comprehensive guide on interviews and how to prepare. It's got lots of ethical scenarios on there with model answers that are going to increase your knowledge on how to approach scenarios like this and how you can implement the NHS values into your answer. But as well as the guide, I also recommend booking a mock or doing a mock with somebody you know who might be a student. So don't make the mistake of not preparing for these interviews. Look up the GDC standards, look up the NHS values, practice, practice, practice. It's not something you can just rock up and hope for the best. You do need to prepare for healthcare interviews. This is the same as for radiography. You do need to prepare in advance. If it's a Zoom interview, make sure your background is clear. You can even blur your background. Dress up smart. You want to come across presentable. Don't forget to smile. I think a lot of people, they're so nervous on the day, they don't smile. Come in there, shake their hand, smile, thank them at the end. If you need any of the links for things I've spoken about, like booking a mock or a comprehensive guide, I've put all the links below, as well as links to GDC standards and NHS values, so you can read up on that. But if you have any questions, you can always message me. Right, thank you for listening.